Hello everyone, I'm Dr. Pritika Shetty, consultant practicing in Pune. I'm a gynecologist as well as obstetrician. Currently I'm at Motherhood Hospital, Kharadi. So today we have selected a very interesting and emerging topic called as polycystic ovarian disease. Almost 15 to 20% of the girls are suffering from PCOD. Now, whenever a girl or a lady has a PCOD problem, either there is a lot of fear that I have PCOD, or people who are supposed to be like understanding that and working out on that are very ignorant on that. So I'm trying to put across few important facts or points to help these girls on that. So first of all, what is polycystic ovarian disease? So what happens when these girls have small water-filled cyst in their ovaries? It looks as a PCOD or a bulky ovaries in a sonography. So as far as it is a PCOD in sonography, you really need not worry. So with the PCOD, if there is any kind of hormonal disturbances, any kind of cycle irregularities, that is the time when you will need attention. So these girls with PCOD can have scanty flow, can have heavy flow, can have short cycles or prolonged cycles, or bleeding in between two periods. So any kind of period irregularities can happen. It is not like every PCOD girl will have a menstrual irregularities. So as far as it is a young girl not planning to conceive for pregnancy at that point of time, even if you have less flow and a delayed cycle, that is okay. It does not need any major attention. But if the periods are very frequent or if there is a heavy flow, that is the time you will need a medical help. That is about the period issues. Second thing, when a couple are trying for pregnancy and if the girl has PCOD with period abnormalities, then it will be difficult for them to plan for their pregnancy. So in that case, you will need a help from a gynec or an infertility expert to help you to know the time of ovulation. Then second most important thing is the cosmetic one. These girls can develop extra hair on the face, they can develop extra hair on their abdominal or on the extremities, they can be darkening around the neck, or they can be weight gain, or they can be even very thin patients can also have PCOD. So whenever these things happens, the main treatment is lifestyle changes. Now the fourth thing is that whenever there is a PCOD, there are possibilities that when you get into your like 40s or 50s, there can be thickening of the endometrial lining. We call it as endometrial hyperplasia. So these are the varieties of things how a PCOD can present. So coming straight away to the treatment or what we should do for PCOD is four very important things. One is about the diet pattern. बहुत बार हमें पता है अच्छा डाइट खाना है, हेल्दी डाइट खाना है, बट हम फॉलो कभी नहीं करते हैं. तो हेल्दी डाइट इज़ वेरी इंपॉर्टेंट. वी कैन टेक अ हेल्प ऑफ डाइटिशियन, यू कैन टेक अ हेल्प ऑफ न्यूट्रिशनिस्ट. टू सम अप, you need to have a good amount of protein, you need to avoid junks, you need to avoid bakery products, drink lot of water and eat more of salads, fruits, seasonal fruits, sprouts, curds. These are the healthy things. And have a fixed time for your meals. Second thing is about exercise. At least 35 to 40 minutes of daily exercise is mandatory for PCOD patients. There are so many PCOD patients who have conceived just with diet and exercise modalities when the other medications also have failed. So exercise can be in the form of running, jogging, gym, cycle, dancing, Zumba. There are multiple options. Only walking or a slow walking may not help for a PCOD girl. So you need a little high intensity of exercise. Third thing is about stress management. Now everyone, every profession at every level have their own stress. So but that should not be the reason to affect your menstrual cycle, or that should not be the reason to disturb your hormonal cycle. So how you can manage your stress is that you can delineate work to people, you can accept the workload how much ever you can handle it, have a good amount of sleep, make things easier, and then pranayam, yoga and meditations are very well known to help to reduce our stress. Then the fourth important thing is the sleep. So important is the sleep pattern and the sleep quality. How long you sleep is very much important, and how deep and how good is your sleep is also very important. So avoid pre-sleeping screen time like scrolling through the phone or laptop, TV before the sleep is very well known to disturb the quality of the sleep. Even if you sleep for 6 hours a day, that sleep should be very sound. Now how these sleep and stress are interrelated to PCOD is that whenever your sleep is disturbed, the internal hormone levels changes. these internal hormone levels are directly related to the sex hormones. So if there is any disturbance in between them, the balance will change and there is very difficulty in conceiving or getting you treated on these parts. Now, very important point across for today's talk is that, especially for the parents, whenever we feel that our kids are getting into a state of obesity, maybe at the age of 8, 9, 10 or 11, ये टाइम है जो हमें पकड़ना है, ये टाइम है जब हमें अटेंटिव रहना है और समझना है कि इनका मेटाबॉलिज्म या इनका डाइजेस्टिव सिस्टम में कुछ तो गड़बड़ हो रहा है, तो करें क्या इसके लिए. सो व्हेनेवर दीज यंग किड्स आर गेटिंग इनटू एन ओबेसिटी, हमें उनके डाइट पे चेक करना है, हमें उनको बताना है कि हेल्दी डाइट क्या है, जंक डाइट क्या है, एक्सरसाइज का इम्पोर्टेंस कितना है. और ये टेंडर एज ग्रुप में अगर हमने कोई टाइम टेबल बिठाया उनको, अगर उनको एक्सरसाइज का इम्पोर्टेंस बताया, तो फिर वो आगे जाके फॉलो करेंगे. ये टाइम में अगर हमने नहीं सिखाया उनको, अगर वो वेट गेन करते गए, once they reach 80 kg, 90 kg, it is very difficult to reverse back. Earlier you pick up, it is important. So to sum up, I would say that if you have a PCOD, do not worry. Focus on your lifestyle changes, and whenever needed, you can take a medical help. Like if you have problem in conceiving, infertility, in conceiving, there are many methods of tablets and things you can take a help. You can take medical help for your cycle regularization, but you cannot take lifelong medication. And this is something which is going to be there with your entire life. So if you do a good lifestyle changes, it is going to help you further. Thank you so much for your patient hearing. Thank you so much.